Michael Lujan with Limelight Health is San Francisco based. He's part of the Launchpad Health Incubator, and let's talk to him.
Hey, Michael, good to have you on this morning. This is Doug. Welcome.
Good morning, Doug. Good morning, Andrew. I'm a big fan of the show, and I'm really happy to be here. I was wondering when you were going to get to me.
We're nice to have you on here.
We get carried away talking to ourselves.
Michael, to kind of kick it off, give our audience a little background or an overview on Limelight Health, but also as part of that, what was your vision? I know you've got long arm of experience from a broker perspective, and just what was the genesis of the creation of Limelight Health?
Sure. So the genesis of Limelight Health is a firsthand experience of being sort of captured, having our data captured. It's all paper-based. It doesn't connect to anything. The three of the four founders, I'm one of the four founders, three of us have been career agents, insurance agents, employee benefits brokers. And much of the technology that we use today is the same we've been using 10, 15, even 20 years ago. So I think it was built out of or formed out of a desire to help advance benefits technology and get it into the modern age. Big believers that data needs to connect. So Limelight Health effectively is the hub where we want to become the standard in the U.S. for rate and benefit data, and make sure that different people, users in the ecosystem, can access the rate and benefit data electronically and seamlessly.
Yeah, it's interesting, Michael. I mean, I find it, I shake my head at times to your point that how many, agents, brokers, employers, health plans themselves still use the fax machine and paper forms in this market.
Nah. We just ordered business cards, and I put a request in, do not put a fax number on my business card. I think it just contradicts everything we're all about. So, amen to that. And moreover, aside from a bad consumer experience, it's also very costly and adds a lot of waste to our system that we absolutely have to get away from.
So can you, just before we dig deeper, Michael, can you share with us kind of the stage of development and rollout that your offering is in? I know that earlier this year, actually just maybe even a month or so ago, you closed a round of funding with MassMutual and their venture arm and a few others, and that would say that you've got great backing. You got great backing from the industry, but it especially at a roughly $3 million, it still sounds like a round. So can you give us a sense for where you are in development?
Sure, it is. It's a Series A round. So we formed Limelight Health, the four founders. We've formed the company about 18 months ago. So prior to Limelight, I was one of the founders at Covered California, the California State Exchange, the public exchange. And when I left the state, looked at the landscape of opportunity, and along with some the other three partners, saw a huge opportunity with Knology, with originally a simple quoting platform that has now evolved into this new hub. So we bootstrapped as a startup for several months, and crazy respect for any other startups who go through that phase and the work that goes into raising a Series A. But
that's full-time work right there.
It sure is. It sure is. And I'll take this moment to acknowledge our CEO, Jason Andrew, and he's really led most of that effort while we get the product in market and get out in front of brokers and carriers. But really fortunate. MassMutual Ventures and Access Strategic Ventures, great partners. Our Series Seed lead investor, Launchpad Digital Health, went in another round of investment also. So that's the stage. We're about 30 employees. We're based in San Francisco. We've got employees all the way in New York City who are feet on the ground at one of our large enterprise carrier clients. And we're growing really fast.
So hey, Michael, so the product, the solution is in use right now? in the market?
It is, and I'm sorry. Yeah, I forgot to answer that question. So yeah, we got into the we launched in the App Store in January and went out to a number of brokers in California, both large and small. Some of them are Fortune 100, and some of them are very small independent agencies and general agencies. And yeah, we've had the product out since January of this year.
That's great. Congratulations. I know that's a heavy lift to get that to market.
It is.
What's your target, Michael, or is there a specific target? I mean, where do you want this to be used, and by who? I mean, what's kind of your primary and your secondary targets?
Sure. So in Limelight, and I should probably describe or explain what the name means. Limelight Health suggests that we put our customer in the limelight. And our core customer are the insurance agents that serve 150 million Americans that get their benefits through their employer. Since most of those employers work with a broker advisor, insurance agent, that's our core customer. And right now, a lot of those folks, some of them are still operating like it's 1989, and they're still faxing a census to a carrier and taking a printed proposal and putting it in an Excel spreadsheet. Hard to believe, but true. So we're trying to help arm agents across the country with a more efficient way to aggregate quoting and maybe more importantly, allow that quoting data to connect with these new Ben admin systems, payroll systems, CRM, HR platforms, and allow that data to, through our hub, connect. Secondarily, and maybe that's no longer secondary, is we've got huge interest from insurance carriers, both on the medical and the ancillary side. Huge opportunities to help drive some efficiencies with carriers, private exchanges, PEOs, third-party administrators. So that's where a lot of our recent interest has been on the carrier side.
Yeah, I was just going to ask you about your view of the private exchange market as a strategic distribution channel as well. And I think you just touched on that.
Yeah, I think they're on track. I think the numbers in enrollment have caught up as 6-7 million current, and I think they're probably going to exceed that 40 million estimate that we all banter around. I think that's on track.
Mm-hmm. Yeah, I do too. So this platform, what's the business model? What is the business model for the quoting platform?
Sure. So it's a SaaS, a cloud-based technology. It's a subscription model. So we, to our core customers, agents, brokers, will sell a licensed seat. We sell them a license to enable their agency to use both desktop and mobile quoting. We're launched in California now, have terrific relationships with the small group carriers in California and collecting data and building relationships with carriers in other states. So we get that data directly from the carriers. It's primarily focused on small group, but this will extend into the mid and large group market as well, fully insured and self-funded. So we provide that data in a really dynamic, first-of-its-kind quoting system. So this will allow a benefits broker. So imagine the hundreds of thousands of brokers across the country that work one-on-one with a small business owner. Many of them using the old systems go out with a printed proposal, very static, not dynamic at all, and make their presentation from that. And when they meet face-to-face with a small business owner, if one little thing has changed, they've added new employees and they want to see new options or new contribution strategies, the broker typically has to go back and start over. So with Limelight, actually our product's called QuotePad. With QuotePad, you can make those changes right there in the room in real time and actually do some contribution modeling. And maybe more importantly to the theme of this show, consumerism, it supports a defined contribution strategy that so many agents and employers are looking for.
If I'm that small business employer, maybe I'm the HR manager for 200 employees, how will this help me directly?
So I think, and it's got to be refreshing. So putting yourself, I like the way you framed the question. So putting yourself in the consumer shoes, they've seen the same presentation in the same format for decades. And most of the insurance proposals, and this process starts with, there might be 85 different plans that are available to me where my business is located. How do I, in a smart way, in a very efficient way, whittle that down to the 3 or 4 that I might really want to land on and offer to my employees? I think that's what this process does. So for them, it's taking a very lengthy linear process into a more conversational pace that supports now, again, a new defined contribution strategy that is more consumer focused.
So can the broker and their client, that let's say that HR director, can they sit in real time together and look at the variables and look at the various quotes and kind of model the right benefit design together?
They can. So, if you think about some of the barriers why we haven't been using technology before in the small group market is most states were fragmented. Most states had different rules and really couldn't get to one uniform way of displaying and factoring rates. And now after the Affordable Care Act, you now have a standard that's more or less consistent throughout the states. And you can now have a system that allows you to do that in a really simple and efficient way, which means table rates. You have book rates or table rates. They don't change. There's no factors that take you up or down 20, 30, 40% like they used to. The rate is the rate in the small group segment. So if we can manage all that data, and I make it sound really simple. I think my data team is probably cringing right now, but it's a lot of work to normalize this data, but do it in a way that allows you to do just that. Display it in a way that you can use sliders. We put some really smart tools in there that allow you to use a slider to kind of model out what your contribution strategy might be. So, yeah, you can do all of this in real time. You still can produce also a PDF proposal and print it out. I want to make sure you're not selling from an iPad. You're still able to produce a really elegant proposal.
Yeah, so you're taking the current data that's now been, made available through the ACA and other law, and you're enabling the efficient use of that data. You're able to sort it and help develop that proposal in a more professional, real-time use of technology fashion.
Yeah, and which is, again, it's something that's been missing. I've been a broker and a general agent for 15 years and was managing sales, small group sales at Blue Shield for almost another 8 years. And throughout that time, it has been a really paper, very antiquated process that can now be fast-forwarded to this. And when you do make that plan selection, you can now, with our platform, you push that data into your benefits administration. So you avoid double entering that information. That's kind of how the market works now. You do a paper proposal, and then when you make a decision, you manually enter that system if you have a ben admin system. Otherwise, it's all paper applications and fax machines. So, yeah, you can now do all of this in a really slick, automated way.
Well, Michael, you're keeping pretty busy, and I really enjoyed having you. You also assumed the presidency of California Health Underwriter Group as well, right? You're the current president, correct?
I am. I'm president of the California chapter. I know you've had our national CEO, Janet Troutwine, on the show before, or had her as a speaker at one of your events. So, yeah, that keeps me real busy. And everyone is talking about technology, not just in California, but maybe especially in California.
I'll reach out to you about our West Coast event, speaking on behalf of the health underwriters and yourself maybe at our West Coast event. I'd love to have you there. But as we close this program, I want to give you the real opportunity to kind of leave our audience with 2 or 3 takeaways.
Sure. And, one of the main ones, and this is not talked about very much, we have a really low health insurance literacy measurement. There's an organization called the American Institutes for Research. They did a really interesting study, and as you talk about consumerism, I think it's interesting that, they did a survey of people 22 to 64-year-olds that asked them if they had a clear understanding of how their health insurance works. And as you would expect, 3/4 of them said, yeah, I understand how it works. But when put to the test, only 1 in 5 could actually tell you how their doctor visit is paid, what's covered. So there's a clear gap between what we think we know and what we actually know. And I think technology plays a big role there in making that simple. That's our tagline, by the way, health insurance simplified. Mobile, there's obviously a great opportunity to get away from desktop, old legacy systems and spreadsheets and get mobile, which, aside from a better experience, helps drive this waste out of the system that actually can result in lower rates. So I know technology sometimes might be a little bit scary or intimidating to folks who haven't used it, but I think if we look at this holistically and appreciate how much we can drive this waste out of the system, I think we'll all be better for it. And connectability, making sure that you're using solutions that actually connect to HR systems, ben admin, payroll. There's no reason why the process has to be so fragmented. So that's the stuff that gets me excited.
Good stuff, Michael, and I really appreciate having you. Let our listeners know how they can get in touch with you, please.
Sure. Our website is limelighthealth.com. And again, we're at a lot of the national conferences and several events. I'm going to be a little coy here because we're expanding in other states, but I'm not yet ready to say where. But keep an eye. We'll probably see you November 16 and 17 at the IHC West event. So I look forward to seeing you all there. If you're in California, again, I'm the president of CAHU, so I'll plug my own event on September 29th and 30th in Los Angeles at the Universal Sheraton. We'll be there. And, in fact, that whole event is focused around employee benefits and HR payroll technology. So hope your California listeners will join us there.
Well, thank you, Michael, very much. Enjoy your weekend. I enjoyed having you here, and we'll see you real soon.
Thanks, Michael.
Thank you, guys. I appreciate being on the show. Thank you much.